I was asked to be the on-site caregiver at an assisted living facility in my community. And I took a tour. The employees were wonderful, very caring. The facility had a pharmacy, it had a hair salon, great dining facility, and it was beautiful. And then at the end of the tour I asked, well, where do the patients get their care? And I was told that, well, the options were the hair salon, common areas, the patient's bed, even the patient shower in the dining facility were all options to render the care. I was concerned about infection control, record keeping, dignity, and cross-contamination of the other patients, because usually when you visit a site as a caregiver, you don't just see one patient, you see many. I thought somebody needed to come up with a solution so that individuals living in assisted living facilities could get their care at the same level and the same standard that people do in the general population. Well, it's very common that in assisted living facilities, dermatologists visit, dentists visit, podiatrists visit, psychiatrists often, county healthcare workers. There's often blood drives, hearing tests, eye tests. And using the common areas, the patient's bed, showers, and hair salon, and even the dining hall just don't seem to be suitable places. I realized early on that I was not the first one to face this dilemma. I found it to be a pretty much pervasive issue throughout the entire industry. And there are close to 50,000 assisted living facilities. And so what I decided to do is start looking at equipment and looking what is out there to help create a solution, and there was really nothing available. So I spent hours and hours and really months and months looking through all kinds of medical equipment. I decided that assisted living facilities needed to be offered one room through which all the healthcare providers could provide their treatment. So I sought the assistance of the best medical and dental designers and manufacturers in the country, and we came up with a solution called the Aleydis Center. The various healthcare providers can rotate through and render the care to the patients, rather than the patients traveling all around their communities. Families need not worry about all those transportation costs and trying to juggle all those appointments. The electronic medical records is a key component. Health histories, the drugs that the residents are on, and the ability to share that information with emergency rooms, primary caregivers, and when referrals are needed, that information can also be shared. Aleydis Centers can be put into existing facilities, and we offer the design work and architectural help with that. But in an ideal setting, we'd either want 12 by 12 or up to 15 by 15 in a new construction. I think providers are going to see quality, they're going to see ease of use, and they're going to see conformity. All Aleydis Centers are exactly the same. So when healthcare providers come into an Aleydis Center, they can focus on the patient, not the newness of the equipment or the change in design. They can be in one Aleydis Center on Tuesday, a different facility on Wednesday, but the center's the same. The response has been fantastic. Comments like, this is a no-brainer, why hasn't this been done before? We'd like to have these in all of our facilities. And it does make perfect sense. These are folks that are unable to get the care that they need, and the providers, it's not working for them either. So the Aleydis Center gives them the solution. Any licensed healthcare profession has to practice to the standard of their state's licensing board. So when we say standard, we don't mean regular, we mean to the highest level. And that's what the Aleydis Center does. Assisted living facilities need to look at how care is currently given and possibly the liability issue. An Aleydis Center certainly can alleviate those worries. It can also alleviate the worries for a healthcare provider with liability issues, because instead of a substandard way of delivering care, we definitely have the top-of-the-line ability to give care the way it should be. Aleydis Centers also has the ability to completely stock and supply the Aleydis Centers on a day-to-day basis, but also be the resource for medical equipment to the facility. An assisted living facility with an Aleydis Center that looks like this will have a huge marketing advantage. When they get to the Aleydis Center, that's going to be the wow. That's when the family is going to say, this is where we want mom, this is where we want dad. And someday when I have to go to an assisted living facility, they better have an Aleydis Center.